It's not your deposition. I'm reading from notes I made of your direct testimony yesterday. Let me ask
I
you.
thought he had some sleeping problems.
Oh, you did? Okay.
But it was hard to sort them out. He was on Dalmane, and it becomes very difficult to describe what the sleeping problems are with anybody who's on a hypnotic.
Now, you said yesterday that there was no test for endogenous depression.
Yes.
Recall that?
Yes.
Well, there's no test for personality disorder either, is there?
That's true.
One gets as subjective as the other, doesn't it?
Yes, they're both subjective. Clinical
Did
judgments.
you read Dr. Fader's deposition?
Yes.
Do you recall whether he concluded there was an endogenous depression?
I read the deposition about 2-3 weeks ago. Could I refresh my memory about that deposition?
Do you recall or not?
I don't recall.
Okay, he'll testify, so we can rely on that.
Okay.
And if Dr. Fader said that there was no, that there was an endogenous depression, he'd just be wrong in your mind, right?
I'd have to ask him about how he was viewing that depression. I'd like to see other material surrounding that statement.
Now, what about Mr. Spodak? Did you participate in the hiring of Mr. Spodak? Dr. Spodak, I'm sorry.
I didn't have anything to do with hiring him.
Did you hear his testimony about whether or not there was a character disorder or not?
No, I didn't.
Were you in any way consulted? I don't want conversation with your lawyers now, but were you consulted on hiring this man?
No.
Do you know Dr. Spodak?
No, I don't.
From his testimony, do you feel he's a responsible psychiatrist?
What do you mean responsible?
Someone credible who you believe who has
He's trying to give an honest statement of what he saw, yes.
You just disagree with him, isn't that correct?
Disagree with what?
Spodak's feeling there was no character disorder.
What he said, as I recall reading his deposition, what did I read of his? I'm getting fogged up. I read something where he described his interview with Dr. Osheroff, and he said he had hysterical traits, histrionic traits.
Pardon, I'm asking about his testimony here before the panel.
Well,
that
I
they heard.
didn't hear his testimony
I'm
before the
sorry.
panel.
Now, you said in direct examination that Thorazine has its own dangerous propensities. Do you remember that?
Yes.
Does that mean you never use Thorazine?
Oh, no, we use antipsychotic.
Okay. You said there were no reports in the literature of Ray's type of improvement in direct examination. Do you recall that?
What did I say?
You say that a sudden improvement like Ray portrayed at Silver Hill is lacking in the
Yeah,
literature.
I haven't seen reports in the literature of that. Usually it's gradual. It's a matter of 3, 4, 5 days. It just is not one waking up in the morning and bouncing around.
You will concede that some of the experts we brought in here to testify wrote a great deal of the literature on the treatment of these types of depression.
Yes.
And they said it was garden variety, it was classic, it was common. You deny that the literature holds that as what they wrote?
Chairman,
I'm not sure.
because we are getting repetitious.
I'll withdraw that. Let me ask you this. Do you really hold yourself out as an authority on the literature with regard to depression?
Which body of literature?
Any body of literature. You read a lot about depression.
I'm not a expert on psychopharmacology.
Well, would you agree with this statement? For the Manual of Psychiatric Therapeutics, edited by Richard I. Shader.
Find out what the position of the witness is regarding the publication.
He will.
Would you agree this is an authoritative publication?
What do you mean by authoritative, Mr.?
A knowledgeable publication, you give some reliability, a known author?
He's a well-known author.
It says, when a patient with an endogenous depression starts to improve on antidepressant drugs, the effect is often striking. You disagree with that?
I think it would be striking over a period of time, not immediately, not within a few hours.
Did Ray ever tell you that he recovered in a few hours?
No, but reading the book, I had the feeling he woke up one morning and smelled the grass, and generally that's not what's reported by people who recover from these depressions with they're treating on antidepressants.
I'm sorry, I cut you
At
off.
least that's not what I'm reading in the literature.
Do you think it's so remarkable that a person who's been in a mental hospital, like Chestnut Lodge, a rather restrictive hospital, for 7 months, and then goes to a hospital like Silver Hill, wakes up one day and realizes he's getting better? You think that's so incredible that you can't believe it?
Well, I'm referring to it was like a miracle, I think the phrase was. It doesn't occur that way. Generally,
Why not? Doctor, let me ask you this,
Can he
Doctor.
may answer the why not question, Mr. Chairman? Or does he want to withdraw that why not question?
I'll withdraw why not and
I
move
thought you
on,
might.
because the hour, and I'm trying to finish by 7:15. Doctor, if you take a man who'd lost all hope in your care,
yes.
records replete with the fact he was hopeless. He said, I'm never going to get better. You said it repeatedly. Remember that?
Yes.
And then he goes to Silver Hill, and all of a sudden, one day, he all of a sudden realizes maybe there is hope. That could be quite sudden. It could happen, can it?
Yeah, but it's a little more complex than that, Mr. Hirschkopf. It could happen like that. But the records at Silver Hill are replete with a lot of other behavior that indicates that this was no quick cure. And in fact, he's become depressed again.
As far as you're concerned, he didn't get better at Silver Hill. Isn't that correct?
I didn't say he didn't get better at Silver Hill. I said he had some symptomatic improvement, but I didn't think there was any work done on his personality disorder.
The Silver Hill records show, without going through those records, which I'm prepared to if you want, but they show, do they not, within 2 weeks, he had a change, he had cooperation with the staff, he had interactions that he had lacked for 7 months at
That's not the
Chestnut
way I
Lodge.
read the Silver Hill records. There was some improvement, but if you read records later on, you'll find that even in the last week of his hospitalization at Silver Hill, they were trying to make sure that he wasn't agitated at night. So it's a much more complex picture than...
When someone gets better, it's not just a uniform getting better, but it's kind of Hegelian flow, isn't it? Where you get a little better, maybe get a step back, and a little better, a step back. That's the progress of getting better in almost any patient,
Well,
isn't it?
it depends upon what you mean by getting better. By getting better, I would see getting better as Dr. Osheroff not having to take antidepressants anymore and having control over his own life and not being subject to what I call disappointment reactions. He has to be on antidepressants because of litigation. I don't see that as getting better, Mr. Hirschkopf. I see that as somebody who is vulnerable, brittle, where a little bit of stress can set off some depressive tendencies. I don't see that as getting better. Now, obviously, these antidepressants can bring about some symptomatic improvement, but do you want to buy it? Or do you want to buy Chestnut Lodge that says, okay, you're going to have to go through a lot of misery, but we want to see if we can really turn you around?
That's a question to me, not in my wildest dreams for anyone I care about, sir. Would I put him through that? Now, let me-
Mr. Chairman.
Jack,
I'll withdraw the comment. Now,
thank
sir,
you
let me
very much.
ask you this. Do you think he's better off, as he was in July of '79, pacing 12 to 14 hours a day, trouble sleeping, barely communicative, aggressive, all the things your records show, or sitting here today, able to go out and have a relationship with a woman, able to go work? Which is he better off doing? Which of those two things?
Oh, he's better off today. There's no question about that.
And was he...
But
I'm sorry, I cut you off. I didn't mean to.
it depends upon which slice of time you want to evaluate Dr. Osheroff. At one time when he was with Dr. Boyd, he became suicidal again. So that making these evaluations, you can go almost from day to day or month to month, because this is a erratic, variable course. There is no gradual uphill movement in which he says, finally, I've got that demon that is obsessed with it, that a demon inside me. I finally understand what it's about, and I'm free of this stuff.
Let me ask you this, doctor. Is there any day, since the day he walked out of your care, that he's worse off than the last day he was under your care?
Well, Mr. Hirschkopf, I thought that he did a lot of psychological work while he was at Chestnut Lodge. He was in the worst part of his depression. He was in the closest proximity to an enormous loss in his life, namely the loss of his third wife.
I'm sorry to interrupt you. Hours late, but I just ask an answer to my question. Can you point to a day he was worse off after leaving your care than the days he was, any day he was under your care?
I haven't been observing Dr. Osheroff. From what I've heard, from what Dr. Boyd says, there are some days when he was quite miserable.
Let me ask you from the Silver Hill records. August 17th, 1979. Dr. Osheroff continued, a progress note, Dr. Osheroff continued on one-to-one special care until today. Beginning with his evening shift, he will discontinue the specials over the next few days. His mood has improved. There is little of the pacing that so far characterized his hospitalization. He has become more interactive with staff and patients for limited periods of time. Last weekend, a woman friend visited him, and he discussed the possibility of living together with her after leaving Silver Hill. Now, was he better off that day than any day he was at Chestnut Lodge?
What date is that?
August 17th, 1979.
He was better off that day, yes.
And do you deny there are a number of notes like that during the 3-month course at Silver
There
Hill?
are also a number of notes that indicate that he was belligerent, provocative, depressed.
May I ask this of the chairman, rather than go through all these different days, may I rely on the panels looking at the Silver Hill records to satisfy themselves on that?
I think they've already read it, Mr. Hirschman.
Okay.
Go ahead affirm it.
I apologize, I haven't been here for the original trial, I was in another trial.
They've reviewed,
Okay.
if I may speak, they've reviewed the Chestnut Lodge records and they've reviewed the Silver Hill records.
It was my intention to go through a number of days. I will spare you that. I think I'm just about done. If you bear with me just a moment.
Oh, my God.
Oh, yeah. He knows that.
Yeah, I want to ask you a question from your deposition, sir. We went over the letter about milieu therapy and asked you a lot about it. Do you recall at your deposition, page 29? Is milieu therapy, is that a term of art that you've heard? Answer, I've heard it, yeah. Is that used at Chestnut Lodge? Answer, if it is used sparingly. Now, is it the case that it is used sparingly, or it is part of their regimen as said in the letter?
It may be in the letter, but I don't, people generally don't talk about milieu therapy at Chestnut Lodge. They talk about the therapeutic environment. That's the common term.
I think I've covered all of it. What did you base it upon that you felt in July of 1979, he would be back in his practice in a few months? What was there in notes?
Where do I say that?
In your deposition, sir. Well, let me ask this. Did you believe that he would be back in his practice in a few months in
I
July of
thought things were
79?
beginning to lift a little bit at that time, and I thought that when they do, sometimes things begin to happen fairly, what you get is a natural remission.
His pacing had not abated at all, had it?
I don't know whether it was abating or not at that time. I know it was continual. But I thought in terms of the way he was psychologically, that he was less ruminative, less tied up in these thoughts.
Can you point to anything in the record that shows he was better in July than he was in March or April?
There are the June notes.
And that's it. You say you and Dingman both felt he would be back in a few months.
Where do I say that?
I'm sorry, let me read you the exact reference, sir. 4 minutes. Let me exact on my desk. Page 96. Both Dingman and I felt that within a few months he would be able to return to his practice. Did Dingman ever tell you that?
We may have had that conversation. We thought he might be coming out of it, yes.
You thought he might be coming out of it. When you said that under oath, what were you relying on?
Our clinical impressions in June.
And what was he coming out of that you thought he'd be back in practice?
He was coming out of some of the depressive affects and getting himself better organized and less entangled in what seemed like a web of thoughts that were torturing him.
No. Oh, yeah. Do you know what the MHPG test is?
Yeah, it's a test for one of the major metabolites of norepinephrine. It's found in the urine.
And when is it used? And what's it used for?
It was used to establish some kind of basal level, and they thought at one time that if you had a low basal level of MHPG, tofranil would be the drug to use, and if you had a high basal level of MHPG, Eleva would be the drug to use.
I'm sorry to interrupt you. I didn't ask what drugs used. I asked what's it used for.
It was for a while seen as a diagnostic a possible diagnostic marker associated or a concomitant marker associated with depression.
For depression.
Yes.
Now, do you know whether or not Dr. Dingman, late in his stay at the hospital, requested that test to test for depression?
No, I don't.
Well, in your deposition, let me read you from page 158. Do you know why Dr. Dingman ordered an MHPG test? And you say no. Do you know what an MHPG test is? And you say, I'm not sure. Is that for? Go ahead. Now, let me stop there for a moment. You said,
Could you
I'm
read
not.
on? Go ahead.
When you said, I'm not sure there, when did you find out what an MHPG
Because he's taking it out.
Because I know it. The
Yeah,
next
thanks.
line
Just
reveals I know what.
I'm going to go on.
Well, let's go on then.
Let's go on.
I'll do what I please, gentlemen. Just stay out of it. If you object, object.
Pretty soon you will,
Shut
Mr.
up.
Hitchcock. Please,
Okay.
sir. Please, sir. Everybody's getting very
You're
short. This
too
is
short
why
to
it's
tell
not
me
good to
to
go
shut
so
up,
late.
Mr.
Well, let's
Hitchcock.
go out in the hall and just try and show
Mr.
them.
Scanlon? Mr. Scanlon? One last question. You got it right now.
Let me read the rest of this. Do you know what the test is for? Is it a test for organic symptoms of a depressive illness? You say, is that 3-methoxy-4-hydro...
Phenylglycol.
Good. Is that what's the question? Question, do you know whether he ordered that? Answer, I don't know that he ordered that. Question, do you have any idea why he would have ordered that? Answer, no. Have you ever found out that he did order that test?
Yes, I know he ordered it now. I didn't know it at the time.
Doesn't it strike you as rather remarkable that two doctors treating a patient and one doesn't know the other ordered such a test?
No, it doesn't strike me as remarkable.
That, you don't consider that poor medical practice?
No.
And it is a test for depression.
It's a test that's somewhat been discredited in terms of reliability. You still have to use your clinical judgment.
Do you know anything about adrenal dysfunction tests?
Yes.
Are they used for depression, detect depression?
Yeah, there's a dexamethasone test that's used.
Did you use that?
No, it wasn't available at that time. It came in 1981. I believe 1980-81.
Do you recall stating you were not well acquainted with a particular body of literature concerning biological problems as the cause of depression?
Yes, I don't consider myself an expert on the biological causes of depression.
And do you think forced regression is a dangerous thing?
Yes.
But however, you were trying to get Dr. Oshoff into a safe regression, were you not?
Yes.
Mr. Chairman, I'll be done within 2 minutes. I know I ran 1 minute over your time limit. And did you feel... Never mind. No further questions.
Thank you. We will reconvene at 9 o'clock tomorrow morning with redirect questions from the panel, then proceed further.
Thank you. Thank you.